Supervisor Johnson, are you on the line?
I'm here.
Oh. Supervisor Angus?
Here.
Supervisor Gould? Supervisor Gould? Okay, but we do have a quorum, so Madam Chair.
Okay. I will hereby call this meeting to order. It's April the 15th, and we'll start out by stating that the Board of Supervisors may by motion recess into executive session to receive legal advice from the board's attorney on any item contained in the agenda pursuant to ARS 3843103. So the official business to come before the board this morning or this afternoon is discussion and possible action, an update from the County Public Health Director to the Board of Supervisors regarding recent issues, actions, events, and county responses regarding the COVID-19 updates and taking the necessary actions based upon the updates. Good afternoon, Denise.
Good afternoon, Madam Chair, members of the board.
I'm here, by the way. I could not get my phone off of mute.
Oh, there he is.
All right.
Okay, I would like to start off with going through basically the agenda that we'll be discussing at our 1 o'clock meeting. Our typical topics, as usual, are hospital capacity, which at this point, our hospitals are clearly prepared for any kind of a surge in cases, surge in need for ICU beds, et cetera. So we're in a good position to address those concerns and issues that, if they arise. For personal protective equipment, we don't really have any updates. Everything seems to be going well. We understand there are still shortages out in the community. We continue to look through the supply chain and try to order for our organization and for some of the others. But we also ask that those agencies, hospitals, healthcare providers, first responders also use their supply chains to attain those same resources. So maybe working from both pathways, we can actually find what we need. As you know, we have Monday, Wednesday, Friday meetings with county, city leadership and first responders and hospitals. We have a 1 o'clock phone call with those individuals. And what I'm planning to do is to try to reduce those to 2 meetings. We would be looking at possibly a Monday, Wednesday, or a Monday, Thursday schedule for those meetings. And in large part, that has to do with our own capacity to have meetings and what we're updating. And I feel like we can accomplish what we need to accomplish in 2 meetings and not 3. So I believe we'll have some support for that, and we'll move forward as such and just try to be mindful of the days of the week and times of those meetings to try to keep them consistent. I wanted to talk a little bit about case notification because this has been a question as it relates to the reporting of cases, whether or not it's on ADHS's website or on our website. So what I've asked my nursing supervisor to do is provide me with basically a process map for what happens from the time of notification of a case until we actually notify and change anything in our own dashboard. And if you wouldn't mind and indulge me, I'd like to go through that process with you so you have that available. So the first thing is through an electronic lab system such as MedSys or otherwise, we receive a notification of a positive result. At that point, we reach out to either the provider or the facility, if it happens to be a hospital where that person was tested, and we request medical records. We request the status of patient notification. We receive confirmation of a patient or patient's family notification. And then at that point, we begin our process of actually notifying internally of a new case, as long as we have all of that information available to us at that point. And during that whole process, we encounter quite often delays of, it could be a half an hour, it could be an hour, it could be longer. But we, of course, never report a case until we know the patient has been notified. So we take as long as that takes in that process. Afterwards, After we've reported and gone through that first part of the process, then we contact the patient to initiate the contact investigation, collect information about those contacts, and begin the contact tracing process and reaching out to those individuals that have been close contacts to that positive case. And then we provide the education and guidance necessary for those individuals to stay safe and prevent the spread. So it's a fairly lengthy process. It's even longer if we get those medical records or if we get that report from an actual provider, because at that point, again, we have to know the status of patient notification, and if they have not notified the patient, we ask them to do so, and then notify us when that's been taken care of. Again, receiving confirmation of patient or patient's family notification, and then it gets notified internally, and then we begin that contact notification. So there's places in that process where we will encounter, could encounter delays, and we don't want it to appear that we are sitting on information or not reporting it out in a timely manner. It's just the timeliness that we get information, and sometimes that delay causes us to kind of step back and make sure that we've taken care and taken our due diligence there. Any questions about the process?
Denise, I have a question. Once you contact the person that's been confirmed positive and then find out where they've been in close contact with other people, do you then go and contact these other people?
We do. We do. We reach out to those that have been listed as close contacts, those that have had either very close repetitive contact with somebody, and the nurses actually assess that particular case, every case and those contacts about what actually could be included as a close contact. So what criteria is used. So they have that conversation with the individual, understand a lot more about where they've been, what they've done, and who they've been around, and for the frequency of that and duration.
And then what is the follow-up contact after that, if there is one?
So we would, with the patient or with those contacts?
With the contacts.
So we would actually follow up with those contacts, and depending upon their risk level, we would give them guidance as to what their next steps would be, whether or not that would be to self-isolate or whether or not that would be to monitor symptoms. And generally, it would be to self-isolate. If they've had really close contact with somebody, we would ask them to do that.
Okay, thank you. Does anyone else?
Madam Chair?
Supervisor Johnson.
What would be the protocol for the people who have tested positive after that first contact? We contact them daily?
We do work with each of the positive cases as far as contact, reaching out to them in terms of monitoring them. So for those that are just suspect cases, I will need to follow up with our nursing division to ensure that I have an accurate answer for you.
I was more concerned with the positive cases. Do we offer them any kind of assistance with help that they might need?
We actually just learned, at least in Kingman, that Kingman Regional Medical Center has developed a group of people and agencies who are offering that kind of assistance, such as, I believe it's actually grocery shopping and helping with some other tasks that person may not be able to accomplish as a result of quarantine. So we do have a flyer that we put in our care packages, which includes a thermometer, so they have that, hand sanitizer, and there are some other products that we give those people who are positive to kind of take care of themselves.
What about if some people are released from the hospital and might need oxygen or things like that? Do we assist with that?
You know, we may not even be notified of a suspect case. We are notified of positive cases, but suspect cases are often just sent home to self-isolate and self-monitor themselves.
Well, I wasn't referring to that. I've heard that some people have been released from the hospital because their symptoms have gone down, but they still might need some kind of medical assistance at home. Are we able to help them anyway? I'm sure it's probably almost impossible to get home health care at this point.
Right. And generally speaking, the hospitals make arrangements for that care through their case managers. After they're released, they have to have a plan, basically, for that person to ensure that they can take care of themselves. So that is generally set up by a hospital.
Are they notifying us, the hospital, I mean, if they release somebody who still is contagious, so that we do follow-ups to make sure they're staying in quarantine?
That's a good question, Supervisor Johnson. I'll have to look into that notification process for you.
Thank you. That's all the questions I have on this one. I do have a few more questions, though.
Okay, Supervisor Watson.
Thank you, Chairman Bishop. Denise, I do have a question. I'm not sure how we can go about answering it without making some people mad, but I suppose it's our job to provide that information no matter what. In the Kingman and surrounding area, we've identified what we call community spread. Have you identified any areas in the Kingman area that would be somewhat of a hot spot or a center of the spread?
Right. We have not actually seen that yet. And even the zip code level data, because our zip code areas are so large, wouldn't really drill down to that level as far as the data goes.
So we've not found a common denominator yet.
Correct.
Do you anticipate seeing something like that?
Our numbers would have to grow fairly large for us to be able to really pinpoint that and to make an accurate estimate of that particular hotspot. And in large part, it's simply because we're not testing to the level that, everybody that comes in gets a test. And so to label an area hotspot is really maybe a false sense of security, because people will think, oh, well, that's where I need to avoid. Well, because we're not testing everybody who walks in with symptoms, we really don't know where it is in a community.
I see.
And so I hesitate to put a lot of weight into that without greater testing numbers to kind of build on that.
Yeah, statistically, you are correct. The numbers just aren't large enough yet.
Mm-hmm. Correct.
That's for sure.
Correct. I'd
But,
like to see them not large enough to do
I
that.
think we need to consistently and constantly warn those folks out there to take every precaution that they can, because now the Kingman area is by far the one with the most cases. Thank you.
Yes, absolutely.
Denise, following up on that conversation just a little bit more, some of the remote communities may have a false understanding that they're not in as much danger of contacting this virus as the ones here in the cities like Kingman, Havasu, and Bullhead. You care to comment on that?
I can absolutely understand that. The real issue is if we were to identify, just as an example, if we identified one case in Dolan Springs, that's one case out of how many people? It wouldn't be very difficult to figure out who that person was. And so for us to get to that level of data release would be irresponsible at this point and actually cause harm, or potentially could cause harm. So we're mindful of the fact that we're trying to release as much information as we can, but our priority is patient confidentiality.
Exactly, but there could be cases in other communities.
That is correct.
And we're just not at the level where we can identify
that service area is large.
Thank you.
And very encompassing, yes.
In Colorado City, Littlefield, they are in the Kingman service area as well?
They're actually in the other category. We discussed this just the other day.
Okay.
Right. So, and oftentimes it's because those individuals would go to a different hospital in order to get service. Kingman Regional Medical Center is not their nearest provider.
Understand.
So,
All right, thank you.
Mhm.
Supervisor Angus, do you have any questions?
Well, I do. It's a little off topic, though. I've been asked if we're going to put up numbers that have to do with people who have recovered.
the state is currently looking into how to collect that information, and we should have more information from ADHS in the next week about recovery pieces. and reporting that data out. I don't know what that will look like, Supervisor Angus, so I hesitate to give you a commitment that it will happen, but I know ADHS is looking into it and trying to figure out how to do that because they've seen it done in other states.
Well, but if you're following them, didn't you just say you call them on a daily basis? Is there a way? I mean, at the end, if they're just feeling better, what is the measure for being, done?
Well, and that's actually part of the issue, is defining what does recovery actually mean. And that's the piece that ADHS would like to define first, and then we can look at the data piece of that, because it would be, we without a common definition for the state, we may be interpreting that term differently, and we want to make sure that we're all on the same page.
Okay, thanks.
Mm-hmm.
Okay, Supervisor Gold, do you have anything? Any questions?
None today, ma'am.
Do you have anything else for us?
I do. Yes, I have a couple of things. We've received, through our department, a number of complaints, and most of these complaints are about businesses not complying with the non-essential, essential service requirements. To date, what we started out doing was allowing our EH staff, who are not quite as busy because of all of this activity, to go out and be that first person on scene, basically to talk with the owner or manager of that business about the status of that and help them understand that they are or are not an essential service. Most are in the not category, of course. But essentially what we're getting an increase in the number of these as the guidance changes, as the governor kind of broadens that view. You're a good example of the Goodwill opening up and how that's now kind of taken over and really played out in terms of the thrift shops and how they interpret that same kind of guidance. But now it's actually taking up more of our time. So we'd like to, and we, as public health, do not have authority really to enforce the governor's executive order. So our first touch with that patient or that business is really just to inform them. And then after that, we would require law enforcement assistance to actually pursue any kind of legal action against that business for being open. And so we will be probably looking for some guidance there and some direction on how to encourage local law enforcement, specifically the cities, to kind of own that responsibility. And I think they have to the degree that they can, but we recognize it's very difficult because they're not driving by to see if a business is open or not. And they're not stopping in every business that is open, trying to educate people. But that'll be an ongoing thing. We're also looking at first responder quarantine sites. And part of this is a discussion related to some of the FEMA funding that's available for healthcare providers, first responders, and homeless individuals. And so I've reached out to Coconino County and Navajo County to get a sense of what steps they're taking or have taken to address that concern. And in Navajo County, Summit Healthcare, which is their major healthcare provider in Navajo County, actually has chosen to take care of their own staff, and so they find motels and hotels for these individuals and places for these individuals to stay during any kind of a quarantine time. And the same is for first responders. The cities have taken care of their first responders in those areas. In Coconino County right now, there's a lot of conversation about this, but no decisions about the responsibility for coordinating or paying for those particular services. So I can update you on those specifics as I get more information and as those decisions are made on at their leadership level. And lastly, I guess I would really like to say thank you for all of your support. You all have been very helpful, and you've asked a lot of questions, a lot of very good questions of us, and we appreciate those and your support. And And all of the employees from Mojave County that have really chipped in and pitched in this effort, because we couldn't do it without you.
Thank you very much. for
Madam
those
Chair, I have a
comments.
few questions.
Supervisor Johnson?
Thank you. At the Lake Havasu City Council meeting last night, you stated that Bullhead City numbers may be less because of lack of testing compared to the Kingman and Havasu. Is testing still an issue in the county, and how can we increase this testing if it is a problem?
Well, so, that's a really good question, Supervisor Johnson, and I say that because Bullhead City, Warm Sea, and Valley View are all following the same testing protocols as Havasu Regional and Kingman Regional. So, the fact that they're not performing as many tests is either a reflection of people staying home when they're sick, or some other factor that we're not aware of, or people not seeking care, and not needing necessarily to go to a hospital to be tested. So I wish I had a little bit more information I could provide you, and I'll continue to look into that.
All right. Do we have any further information on if someone can catch the COVID virus twice, and if they do catch it twice, can they still pass it on?
Certainly. So right now, the latest research shows that there may be up to 11 strains of this. So mutations, basically, right, over time. And so basically, a person can build up some, immunity. Thank you, to this. But if they were to get a different strain, it's just like a flu, right? In that sense of having different strains of flu, it may be less serious, it might be more serious. It might be something where you've built up enough immunity because you've basically recovered from the virus once, and your body's built up some immunity, so the second case may not be quite as severe. So there's still a lot of research going on about the severity, the mutations and evolution of this virus, and how many new strains are out there now.
Will they be able to pass that on?
I believe if it's a different strain, the answer is yes, but I will confirm that as well.
Okay. I'm also hearing that talks of antibody testing. Some are saying they're working on the test and they will be available within weeks, and others are saying we do not know the specifics enough to have an accurate antibody test. Have you heard any of this?
I have, yes. So there are some serology tests available now, or will be available in the very near future. It's thought that they're about 95% accurate, and the best, so actually the governor just released information. Let me find that real quick because I did bring that in about, there we go. Governor announces antibody tests for health professionals and first responders. And so this was yesterday. And so they are partnering with U of A on 250,000 tests. And these would be primarily used for first responders and health professionals, and those people that probably had the best chance, if you will, of being exposed, even with the proper PPE. Or actually not with the proper PPE, but just with the exposure to cases as they're being transported to a hospital or seen by a medical provider. So this is something that I think is going to be a growing topic, and will evolve probably over the course of the next month about how this is done, where it's done, who you're going to target, maybe even over and above your healthcare professionals and first responders.
Okay. My last question is, when someone goes to the hospital with symptoms they feel are COVID-19 related, obviously some are being tested because they meet all the criteria, and some might only meet part of it, but they're being told to go home and quarantine, and that's what's causing a lot of questions that we receive. When they do go home, if they're, I'm guessing they're being told that their symptoms get more severe to come back to the hospital. Would that be true?
If their symptoms are severe enough to come back to the hospital, yes. But that severity is really very subjective. I mean, certainly if someone's experiencing shortness of breath and don't feel like they can breathe, that would be a very normal symptom for people to just immediately go to the ED to get care. So they are
right,
given
thank
guidance on that, yes.
Right. Thank you. That's all, Madam Chair.
Okay, Denise, when a person is tested, does the test identify which strain of this virus has been identified?
You know, it's another very good question that I'll check into because I don't have that information available to me.
Okay, and then currently, how many positive cases do we have in Kingman?
Hang on,
I know we're at 50 countywide,
right?
and at least one of those was Kingman.
We have 28 cases in Kingman,
28. Okay.
18 in Lake Havasu City, and 4 in Bullhead City.
Okay.
Mhm.
All right. Any other questions? Comments? Going once, going twice? Thank you, Denise. We're adjourned.